Are you tired of seeing low engagement on social media? Feeling confined in a box of traditional or flat content? Are you struggling to get covered by media organizations?
Don't miss this exclusive session of Stop the Scroll to unlock modern marketing strategies that break through the noise, establish brand awareness, and help build genuine community trust. Operators are not standing by, but your future fans are.
Hello friends, I'm your host, Faro Palazzolo, and welcome to a very special episode of Stop the Scroll. Today we have such a treat for you. Live and in studio, we will be chatting with the team from the one and only Jefferson County Public Health, gateway to the Rockies in beautiful Colorado. Today we're going to ask the tough questions and get to the bottom of how this little health department in the middle of the most beautiful state in the country was able to... Our first guest is going to spill all the tea. She's going to spill all the tea about how this crazy experiment in communication started. You may know her from her past experience as a YMCA Zumba instructor until she was fired for not using enough official Zumba songs. Please welcome Dr. Sarah Story. So what makes you think that you're qualified to be here?
Wow, what a question to start our friendly interview. Sadly, I ask myself that all the time. I'm trying to do that less, but I was in public health as a deputy director, and I left in 2018 to join a startup that was creating data storytelling platforms for everybody, right? For public health departments specifically, we knew that it was a real challenge for all sorts of employees to use data science. And so we were really focused on what is the problem we're trying to solve for these health departments. And it was a blast. I loved working in a startup. I was there for 4 years, and you have to do every sort of job as a startup. You have to be chief marketing officer and chief of staff and product development. And in that process, I learned so much about building a business, but I also learned a lot about finding our customers. And there are so many tools that the private sector is using to figure out, what does my audience want to hear? What is our brand? What's our promise, right? What is our story? And I thought, as I came back to governmental public health, which I swore I was never going to do, I said, never in a million years am I going back to work at a health department. But I woke up one morning, I was working in big tech, and I just felt called. I felt like I can't do this anymore. I want to be back home. That's what it felt like. And here I am in Colorado, where I had never been before. I think I'd been 2 times to Colorado before I interviewed here, and had never been to Jefferson County. And so with me, I brought those tools and that mindset of working to get the customer's loyalty, for them to trust us. And I was really intrigued by how could those private sector mindsets work in a public sector environment. And here we are. And they took a chance on me. So that was lovely.
As I'm sure you know, our audience's time and attention are very valuable. Why does any of this matter to them?
Wow, what a great question. Faro, may I call you Faro? Thank you. Just in all seriousness, we are truly, as a field, in a fight for our existence. And if you had asked me this question a year ago even, I think I would have gone on about, we need people to be educated, informed, and I would have been a lot nicer, I think. And I'm not feeling nice anymore. And I know many health departments across the country are feeling this urge to resist and to fight. And that's a very different spirit than the field has had prior. I think coming out of the pandemic as a field, there was this hesitancy to be radical, to be revolutionary, and we are forced to do that now. And I think that the weird upside of everything happening to discredit our field is that it's causing us to get more creative, and it's causing us to fight a little bit harder. And I think that one thing you should know about our county, we're a weird county. Like, it's a very strange place. We're a long, skinny county, and we're a first-ring suburb of Denver. And then we're also rural. So we have, and I hate saying that word, so apologies to the audience because I just pronounce it kind of funny. But this rural contingent, there is a lot of distrust of government, period. Right? And then, so you have this primarily white, somewhat affluent, some very poor in our mountain communities. And then you have our denser communities where we have people of color, newcomers, right? So the challenge for us is to really try to appeal with our story and our brand to all sorts of people. And back in the day, it felt like we were competing against big sugar or competing against the tobacco industry. Now we're competing against a lack of humanity and xenophobia and racism and all of these, and fascism, and that is a very different challenge. And I think everybody should care about science, right? Everybody should care about truth, and that's what we're selling now. What we're selling is truth, and that's a really tall order for a small health department in the middle of the country.
Well, I don't know about you all, but I hate fascism. Selling, huh? That sounds an awful lot like marketing to me.
Well, it's funny you should say that because it truly is. And I think that one of the saddest things about the public sector is we often don't feel like we have the confidence to claim those terms that, you know, the business community uses, but we're all doing it all the time. We're doing it for ourselves, you know, when you're on the job market and you're trying to get someone to do something, to buy you and to believe in you. That's marketing. But we have to be very careful, and I think when my colleagues come out, they'll dig more into this, but there is this field of communications, right? So when we use the word communications, we're talking about delivering information, building relationships, getting people what they need when they need it. And that could be crisis communications, strategic communications. There's so many fields of it. And it truly is, and I think you'll learn when you meet the team, it's a science. There's a science to communications, and it's a real skill and a real talent. Marketing is a subset of that. It is one thing only. It is selling. I am trying to get someone to do something. I'm trying to buy their loyalty. I'm trying to get their vote. I'm trying to get them to put that cigarette down. The marketing is a very specific subfield of communications. And I think one of my tasks in coming to this department and taking this role was like, I want to get marketing to be part of who we are and what we do and to just own it. There isn't anything wrong with marketing, right? Marketing is actually a way to develop our brand story. And I know people may roll their eyes at that, but it's truly about reducing friction for people. When they have a decision to make, you know, it's, you think about going to your favorite convenience store. You walk in and you know what a Coca-Cola looks like. You know the color, you can close your eyes right now. You see the logo, you see the cute little name on the side that, you know, you try to find a good one on the can, right? If you didn't know what Coca-Cola was, you would waste a lot of time trying to figure out what soda should I get. And you might grab a Pepsi because you don't know. And then that's gross and disgusting, and you're stuck with the worst soda of all time, right? There's no like debate there or discussion. You ruined your life because you didn't know to grab a Coca-Cola with its signature look, right? So we're trying to develop a signature look, and Noella, who is a genius, will be coming out here later. She's gonna tell you how do we even find that voice? What is our logo? Because we wanna be Coke and we don't wanna be Pepsi. That's probably the most important takeaway of all of this, is like, we wanna be Coca-Cola. So when I came into this job, I said, I've got two things I need to do. I need to get this comms team rallying around the idea of marketing, And I have to integrate that comms team with the policy team. And the second thing I wanted to make sure everybody did, and do I have a copy of my book? Could I get the PA to throw me a copy of the book? I really wanted everybody to read this book. So you just throw it over here and I'll catch it. Talking Health. And I don't know if you happen to know this, Pharaoh, but I have a chapter in here. You can read more about my philosophy on branding and marketing in Talking Health. I believe you have a surprise for the audience.
That's right. If everyone will look under their seats right now, you have your very own copy of Talking Health. Amazing. You know, I'm more of a Dr. Pepper girl myself. On the topic of policy and how structure leads to optimizing your team, we have everyone's favorite policy queen, Kelly Curl. When she's not busy diving deep into the world of policy, she's growing everyone's favorite Colorado legal plant. Hello, Kelly.
Hi, thank you for having me.
Of course.
Just to be clear on the plants, they're heirloom tomatoes. And yes, I'm the Director of Policy and Public Affairs here at JCPH.
Policy, interesting. Not every department has someone in a role that combines policy and communications. Can you tell us a little more about that?
Yeah, it is unique. I think in Colorado, I'm one of about 3 other folks that are kind of a similar type of position across the state. And we're very lucky to have that at Jefferson Public Health, and we were one of the first in the state to have a position like this.
Tell us a little more about what your job looks like on the day-to-day.
That's a great question. I mean, really, it changes, I mean, moment by moment sometimes, especially in today's climate. There's new proposed policy changes kind of at all levels, from the federal level as well as the state level. And then certainly we see it locally as well. And then there's the run-of-the-mill things that come up. You know, the weather's warming up, we have bats coming out and folks interacting with our wildlife. So things can really vary throughout the day or even week to week about what we're focused on with our proactive stuff as well as our reactive communications that are still necessary.
Now, Dr. Story mentioned restructuring. Before, communications lived within another division that included emergency preparedness. Dr. Story moved comms and policy efforts into one unit, the Office of Policy and Public Affairs. Tell me a little bit more about this restructure. Why was this change needed?
I think given where our structure had been for many years, a lot of these efforts were really spread across the department in different teams, different divisions. Our organization had gone through a lot of organizational and restructural change over time, some of it intentional, some of it kind of just the force of change going on for public health and for our agency. And it really led to a lot of siloing and disconnection. So folks weren't always connected with each other's work, aware of what was going on. And it led to a lot of siloed and reactive approaches to the things we were hearing from community or the needs that we were seeing. And so this restructure with Dr. Story's leadership really kind of demonstrated a change in philosophy about how these functions, because policy, communications, marketing, strategic messaging are all different subsets of the same thing. And we can reflect that in our org structure and bring all of these teams under the same umbrella to be a department-wide support for all of the efforts that we do. Bringing communications together with our policy work, some of it still being subject matter focused, but also broadening that over time to really be a broader policy and a kind of influencing change that can have some lasting impact through policy using tools and strategies from communications and marketing to do it.
May I?
Of course.
Cut in just for a second. I think the idea of having policy and comms in the same shop, and we call it an office is kind of a new term we use. It's kind of a rough and tumble division, right? And we also hate the word division because it divides naturally. But an office is kind of a nimble response to a need, right? And this office in particular, moving it into the administrative function, signaled that our policy work and our comms work is, as Kelly mentioned, a department-wide service, a department-wide necessary function. And I think policy and comms have to be side by side because so much of what we choose to do in comms is influenced by policy decisions that are coming down the way. So when those things operate in vacuums, we could be doing National Taco Month At the same time, we're trying to pass really important legislation on labor laws, right? And that incongruence makes it look like we're not talking to each other and makes people trust us less. So it's all part of the strategy to think through, what do we have coming that we need someone to do? And how do we work backwards to set the stage now with our communications platforms? And so it's a lot of strategy and it's a lot of moving pieces, but Kelly is such a wonderful leader, and she's so good at making sure those pieces all move in the same direction.
I do apologize for Dr. Story's violent outburst.
Yes, super smoothly, as all reorgs generally do. Yeah, there were some bumps along the way. It was all the teams that now comprise my office had been through significant changes. These teams had gone through the pandemic, which had its own challenges outside of what pre-existed the pandemic. And so it was more change on top of a lot of change that had already been something these teams had gone through. And the burnout was real from the pandemic, and we were still in the midst of that. And now we're adding this to it as well. So there certainly were bumps along the way in that regard, and trying to kind of convey this new vision for what this office, which hadn't existed before, is, not only to these teams, but also within the department as well. There was almost kind of an internal, public relations need that had to be strategized between Dr. Story and I to rebrand, in particular, the communications team, which has really been more of a transactional relationship with a lot of our teams. They were there to help make sure that the branding looked right and the fonts were correct and, dress up this flyer. And we were really challenging that, both for the team directly, but also that perception of that and that relationship with other teams across the agency to say, they are a strategist. They are a core public health function who are experts in their own right, and they will consult with you about how to meet your goals, which was just really different than how that had been before. And that's taken a lot of intentional effort on Dr. Story and I's part to work towards that change internally within the department, while we're also trying to do that externally with the communities we serve too.
Speaking of thinking bigger, Jeffco is the largest, most beautiful, most highly funded county in all the land. Let me just put this out there. What about the smaller departments?
No, you're right. We're lucky. We have a lot of resources. The scenery is amazing, of course. But we are well resourced. But that took time. That didn't happen overnight. Having a team with as deep a bench as we have, and the amount of skill sets we have, was something that we intentionally invested in and built up. But we started with a smaller team. We started without my initial policy role, which was the first to kind of be a department-wide asset around policy. So start with the talent that you have. If you're a smaller department, you have good resources, even if they're not the same as Jefferson County's. Invest in your teams. That may be the person in your traditional communications or social media role. It may also be someone tucked elsewhere doing other functions in your department who has that creative eye, that eye for strategic messaging development, who can be tapped into this role as well. So get creative with the resources that you have and invest in those folks. And I think most importantly for leadership, no matter what type of department it is treat communications and marketing as a specialty that it is, and invest in the folks that you have in those roles, because that will be really what will boost the skill set, the capabilities, and your presence with the community and your credibility with the community, is really elevating that as a core public health function and investing in it in the way that it truly deserves.
Speaking of investing in people, let's meet one of Jeffco's greatest investments, the driving force behind our creativity, Noella Rios. Hi, Noella. Welcome to the show.
Thank you for having me.
Tell me a little bit about the shift to integrate policy and comms from your perspective. Was it difficult?
Yeah, I think integrating policy with communications was not just a structural shift, but definitely a mindset shift. Traditionally, comms would come in at the end of a project, like we're complete, now we need communications. People would approach us with, here's a flyer, or here's something that we need, make it look nice. And to really make an impact, we had to reframe communications as a strategic partner from the beginning. And it was hard. It required redefining roles, building trust with our partners and programs, and really protecting space for creativity. And I think that once we were able to align our goals with policy needing influence and communications needing connection, it was a natural fit.
What were some of the initial struggles as communications began to take the lead on some of these key initiatives?
There was definitely some friction. People are so used to coming to us and with a project or a need and getting a deliverable. And so I imagine when we started asking questions like audience, tone, goals, it felt disruptive. And so we really had to work through and show our staff and our program teams that our process was going to lead to better outcomes, more engagement, and even more media pickups. And through that, they slowly started trusting us and us investing more time in creative strategy and campaign development. But there was also capacity issues. Our team couldn't continue doing all the things that we were doing in campaign strategy. So we invested in structures and systems like Canva trainings and templates and toolkits to empower staff to do these things, these lower lift items on their own, and free up space for our team to tackle higher impact creative development campaigns.
What was different in the before times? How did you know that you needed to make a change like this?
Yeah, I think that before, communications was definitely only reactive. We were looked at as a service desk. Our work was filled with really text-heavy flyers and generic graphics, really traditional social media posts that were heavy in textbook medical information. So we were really checking boxes to meet internal needs and not meeting the community where they are. And honestly, our metrics reflected that. We saw low engagement, low impressions, and really a comms team that was burning out on work that was neither creatively or professionally fulfilling.
Let's shift to talking a little bit more about your work. How do you come up with these ideas?
Yeah, it starts with asking the right questions. So who is this for? And what do we want them to feel? Not just do or know, but what do we want them to feel? And we look at what's trending outside and inside of public health, both visually and emotionally. And we draw inspiration from unexpected places like books or our families and really just the real world that our audience is living in. But the process really starts with us sitting at the table with our subject matter experts and really so our team can understand all the important aspects of whatever said topic is and create messaging that is both accurate and resonates. And then our team takes that information into creative space where we start building that messaging, the tone, the visuals, and overall campaign structure. I think one thing that we really have worked hard on, as Kelly referenced, was we trust our subject matter experts to lead content expertise. And so we worked really hard to elevate our comms team as experts in creative space and campaign strategy to really bring these campaigns to life effectively.
Now you mentioned campaigns, and you've got the blazer for it, but I don't think you need a political campaign. So what does that mean in this context?
Yeah, so when we say campaign, it's really a robust, full force effort that usually is tailored to shifting perception, usually about JCPH, or driving action to something. And it's a full package. It's from our brainstorms to creative brief development, media strategy, and really just the emotional journey that we want to take our audience on from start to finish. And so we separate our work mainly into two spaces. Our large campaigns, our campaigns are really a large scale, full force of the comms team with creative development, tone development, and sometimes partnership opportunities. And the items that fall outside of that, although still thoughtful, they're usually leaner in a scale and worked into our normal owned and earned media strategy.
Can I add something to that? Is that okay?
Yeah.
Another outburst.
And that's great. Yeah. Very excited about this topic, as you can tell. I think another great point to build off of what Noella was saying about what is a campaign is that that's going to expand beyond just the imagery and the fun stuff that you see that you know us for. That is ground game too. So for example, our West Nile virus campaign wasn't just some glossy images made to, stop you in your tracks and be like, what the heck is that? It was also on the ground distribution of DEET, right? And so it's that low tech, high tech marriage that is a campaign, and campaigns are so much work that we only do, 9 campaigns a year, maybe 9 to 12, because they are all encompassing. But you will see on our channels, we have content constantly, but we only do campaigns for the highest tier priority issues. So I hope that helps answer that question too.
How does all of this interact with social media?
Yeah, so social media is just one part of our campaign deliverables, but it is a big part. And it's often our launch pad. It's where we test our tone, experiment with visuals, and really amplify our reach. But we do it in a way where it's not just a bulletin board. It's about connection and conversation, not just here's an announcement. And we tailor our tone to each platform differently. So Instagram might get something bold and visual. LinkedIn might get something thought leadership based and behind the scenes, whereas our Facebook is really a mix of practical and heartfelt. So really tailoring each thing to each audience.
How do you measure success in this kind of work?
Yeah, so we track the normal social media metrics, reach, impressions, engagements, but really that's just the surface level. We also do targeted campaign analytics, which are web visits, sometimes event attendance, policy action, even internal engagement. But really, I think the best indicators of impact are qualitative. So did this spark a community conversation? Did a policymaker reference it in their work meeting? Did staff feel proud enough to share this on their personal platform? That's 1,000% a win in my book.
What are some tools that another organization could use to try to replicate this kind of success? Are any of them free?
I think when budget is tight, the most important thing is strategy and creativity. We often default ourselves to free tools such as Canva to still create high impact items. We utilize AI to help us work faster and generate more ideas, especially when time is limited. Just figure out if your county or your organization has platforms or software that they're already a part of that maybe you can be added as a seat to. And really, the key is not to have all the tools. It's to utilize the tools you do have to amplify the creative resources that I guarantee everybody has.
What are some suggestions for an organization that hasn't yet found their own unique voice?
Yeah, it really starts with a content and brand audit, a voice audit. That's how we tackled it. And we realized that we were often defaulting to jargon and neutrality, and so we changed it. We started testing tones on platforms and seeing what had more traction. And what we found is we were trying to be everything to everyone. Each audience is different on each platform, so your voice should be different on each platform. And when we really found our voice and started just being fun, human, authentic, that's where we really met the community where they are.
Well, body like this doesn't come easy, so I've got to get to the gym. We've got about 15 minutes, so I'm going to give each one of you about 30 seconds to wrap things up and give us your last thought.
Great, I'll start. This dynamic and this team and the creativity doesn't happen without an executive director or a boss or someone in leadership who values creativity and inspiration. You have to give your people time away from their work to be inspired by art, by nature, by the city, books, music. That is how you get creative output, is having creative input, and you have to value it in your organization. 30 seconds.
Kelly.
I think, especially with the leadership support in place, really for folks that are in communications roles, whether that's a leadership role or a single person team, is really leaning into curiosity. Being in a silo will not make communications or your creativity land with your community if you don't have those connections in the community or your connections to your subject matter experts. They may not be your communications experts, but they are absolutely essential to making sure that your information is accurate and includes the important details that need to be there. And that requires a lot of relationship building internally and leaning into curiosity to learn about the work that these different teams do.
And I think my best advice would be to shift your mindset, make that mindset shift, because communications is not just a service, it's a strategic tool. And so lean into that authenticity and that creativity.
Thanks for joining us here today on Stop the Scroll. This has been Jefferson County Public Health with a few tidbits for growing your organization's communications and policy work. Now go on, get